Welcome to The Debate. Today we're turning our attention to the invisible nervous system being built around us right now. We're examining the rapid proliferation of the Internet of Things, or IoT, but we're not discussing smart refrigerators ordering milk or voice-activated light bulbs. We are looking at the convergence of smart cities and smart hospitals. We're analyzing a future and, a present, where the traffic lights, the power grid, and the pump delivering medicine to your veins are all part of the same digital conversation.
And it's a transformation that promises this sort of utopia of efficiency. But the central question we have to wrestle with today is whether this intelligent hospital embedded within a smart city is a necessary evolution for public health, or if we're building a massive interconnected house of cards. We really need to determine if the sheer complexity of these systems creates safety and security risks that we are fundamentally unprepared to manage.
To explore this tension, we're drawing on two significant academic texts. I'll be championing the vision laid out in the 2025 study, Adoption of Internet of Things for Smart City-Enabled Smart Hospitals by Javaid, Halim, Singh, and their colleagues. This work lays out the blueprint for how digital transformation is, really the only way we can sustain our healthcare system.
And I'll be countering that perspective using the insights from the Computing Community Consortium, specifically their paper, Safety, Security, and Privacy Threats Posed by Accelerating Trends in the Internet of Things, by Fu, Kono, Lopresti, and others. Their argument is, frankly, stark. We are embedding intelligence into the physical world without any real framework to control the consequences.
I represent the position that this integration isn't just beneficial technology, it's a moral and demographic imperative. We have an aging population, a shortage of resources. We simply need this efficiency to survive.
And I represent the view that complexity is the enemy of safety. By connecting everything, we're introducing zombie vulnerabilities, privacy erosion, and physical safety hazards that, frankly, no amount of efficiency can justify.
So let's begin with the fundamentals of the argument from Javaid, Halim, and Singh. When they define the Internet of Things in 2025, they're very clear that we aren't just discussing gadgets. They describe a vast network of connected sensors that are, essential for modern existence. The primary objective here is the realization of the intelligent hospital. This is a paradigm shift where medical devices, things like infusion pumps, smart beds, biosensors, are converted from static tools into data-gathering assets. The argument put forth by Javaid's team is that this connectivity removes human error from the equation. We're looking at the ability to perform real-time monitoring of critical conditions like heart failure, diabetes, asthma attacks, where the device alerts the staff before the patient even feels a symptom.
I understand the utility of the individual device, but I think we need to look at the context in which these devices operate.
But the context is exactly where the value lies. It isn't just the hospital building, it's the smart city context. Javaid et al. Describe an ecosystem where the hospital interacts with the city infrastructure. They give the example of smart traffic management. In this system, an ambulance doesn't just blare a siren and hope cars move. The ambulance connects to the city grid and gets a green wave of traffic lights to reach the emergency room faster. It also involves smart energy grids that ensure absolute power reliability for life support systems. My thesis is that this integration of miniaturization, virtualization, and biotechnology is a necessary digital transformation. We have an aging population, a rise in chronic illness. We simply can't manage these logistics with analog tools.
I appreciate the picture of efficiency you're painting, but I have to push back on the premise that connectivity equals reliability. I come at this from the perspective of complexity, which is a concept central to the work of Fu, Kono, and Lopresti. It's true that these devices offer individual benefits, but while securing a single device is difficult, securing a collection of interacting devices, which is exactly what you're describing, is exponentially harder. In fact, Fu and his colleagues argue it's currently an unsolved problem in computer science.
Unsolved in what sense? I mean, we have secure banking, we have secure military communications.
Sure, but those are closed systems. You're describing an open, fluid city environment. We are introducing a new category of risk: physical safety versus cybersecurity. When a traditional computer crashes, you lose data. It's annoying, but it's generally safe. When a compromised IoT system fails in a smart hospital or smart city, It affects the physical world. We're talking about heating systems shutting off, door locks failing, and medical dosages being altered. Fu et al. Highlight the very real threat of ransomware in hospitals, which we've already seen happen. But the danger is deeper. We're embedding sensing and intelligence into every device without a framework to manage the safety, security, and privacy implications. We're creating a fragile ecosystem that is highly susceptible to adversarial attacks.
I see why you think that, but let me give you a different perspective on the reality of connected care. You mentioned the risks of the system, but we have to weigh those against the risks of the status quo, which is often delayed intervention. Javaid et al. Focus heavily on patient outcomes. One of the most compelling applications they discuss is remote patient monitoring via wearable health technology. We're talking about fitness bands and smartwatches that track vital signs. This technology allows non-critical patients to stay at home, which reduces hospital overcrowding, a massive issue in urban centers.
But that stay-at-home model is exactly where the security boundary collapses. You're taking a patient out of the relatively secure fortress of the hospital network and placing them in the wild.
I'm not convinced by that line of reasoning because the technology exists to handle this data safely. Javaid et al. Discuss using cloud computing and edge computing, and I want to be specific about edge computing because it addresses your concern. Edge computing allows data to be processed closer to the source, on the device itself or a local gateway, rather than sending raw data across the world to a central server. This reduces latency, which is critical for health alerts, but it also minimizes the exposure of the data. And furthermore, this connectivity allows radiologists to exchange high-resolution images instantly, regardless of their physical location. This accelerates diagnosis.
That is a compelling argument, I'll grant you, regarding resource allocation and speed. But have you considered the digital environment those remote monitors are operating in? Fu et al. Raise a critical point about the home as a backdoor. When you send a patient home with a heart monitor that connects to their Wi-Fi, the hospital's secure network is now bridged to that patient's home network.
And why is that inherently unmanageable? Most home networks use standard encryption.
Because the hospital has no control over the other devices on that network. Fu et al. Use a hypothetical example. That is, it's quite terrifying in its banality. Imagine a home network with an iPhone, a Ring doorbell, an Amazon Echo, and an Xbox. These devices interact. They share bandwidth, discovery protocols. If the teenager in that house downloads a compromised mod for a game on the Xbox, or if that doorbell has a hard-coded password, the attacker has a foothold. What vulnerabilities does the gaming console introduce to the heart monitor? We're seeing the rise of what Fu calls zombie devices.
You've mentioned that term, zombie devices, but surely outdated tech is just a nuisance, right? Not a critical threat?
It is so much more than a nuisance. A zombie device is an IoT device, say a smart thermostat or a webcam, where the manufacturer has gone out of business or simply stopped supporting the product. The device still functions physically, it's still on your wall, it's still connected to your Wi-Fi, but the software inside it will never receive a security patch again. It contains unpatchable vulnerabilities. It effectively becomes the living dead on your network. If you place a hospital-grade medical device on a network populated by these zombies, you are exposing the patient to permanent security holes that can't be fixed.
Okay, I acknowledge that legacy hardware is a significant challenge, but I would argue that the systemic benefits of the infrastructure outweigh these edge cases. Let's broaden the scope to the smart city ecosystem as described by Javaid et al. It's not just about the patient's home, it's about the urban environment that supports their health. They discuss smart traffic management in detail. And this isn't just about convenience. It's about sensors detecting congestion and rerouting traffic in real time. It's about that green wave for emergency vehicles I mentioned earlier.
But again, you're just adding more nodes to the network.
Essential nodes. Even smart waste management plays a role. Sensors in garbage bins notify trucks only when they're full. This reduces operational costs, it reduces traffic congestion from garbage trucks, and it reduces pollution in the city, which directly impacts public health. Javaid et al. Argue that these efficiencies free up financial and energy resources that can be redirected back into patient care. They also cite the emergence of blockchain and AI as methods to secure this data transparency. The technology is evolving to meet the security needs.
I'm sorry, but I I don't buy that adding more complexity increases security. You mentioned smart traffic lights and waste bins. In cybersecurity, we talk about the attack surface. Think of your home. If you have one door, you only have to lock one door. If you have 50 doors and 100 windows, your attack surface is massive. You are describing a city with millions of unlocked windows.
But are they unlocked?
Often, yes. Fu et al. Cite the historical example of the Mirai malware attack. This is crucial to understand. The attackers didn't hack a supercomputer. They scanned the internet for IoT devices, cameras, DVRs, routers that were using default passwords. They infected 380,000 of these mundane devices and turned them into a botnet. They used the collective power of those devices to launch a distributed denial-of-service attack that took down major internet services.
That was a disruption of service, certainly. It was expensive and inconvenient. But it was not a safety failure in the medical sense.
But in the context of the smart city you just described, a disruption of service is a safety failure. If the traffic management system goes down because the smart waste bins were hacked and used in a DDoS attack, that ambulance doesn't get the green wave. It gets stuck in gridlock. The patient dies. Furthermore, Fu et al. Bring up the historical example of the Therac 25 radiation therapy device. That wasn't even a network hack. It was a software defect that caused massive lethal radiation overdoses.
That was a tragedy, yes, and a lesson in engineering ethics.
It was a lesson in what happens when software controls the physical world. When you scale that up to a fully connected city or hospital, you have to think like an adversary. An attacker wouldn't just turn things off. They could intentionally trigger worst-case configurations. Imagine malware that doesn't shut down the system, but subtly modifies electronic prescriptions or dosages in the database. You wouldn't know until the outcome started deteriorating. That is the systemic fragility we're building.
That is a dark picture, certainly. But it ignores the immense power of the data we're generating to prevent harm before it happens. Javaid et al. Champion the value of big data in this equation. By analyzing massive volumes of data, vital signs, environmental parameters, traffic patterns, healthcare professionals can use predictive analytics. We can predict illnesses before they worsen.
But at what cost to privacy?
The benefit is accuracy and resource optimization. For example, cities use smart meters to allow utilities to bill accurately and detect leaks. This benefits the consumer. In the hospital, smart predictions allow administrators to predict patient inflow based on seasonal patterns and citywide health data. If we know a flu spike is coming based on sensor data, we can staff the ER appropriately. The argument is that these macro-level benefits outweigh theoretical privacy concerns, especially when Javaid et al. Note that technologies like blockchain are being developed specifically to handle decentralized secure data exchange.
I think labeling these concerns theoretical minimizes the problem. Fu et al. Use a very effective analogy to explain the problem of inference, the smart fork and smart plate.
I'm unfamiliar with that specific analogy. How does it apply here?
It illustrates how benign data becomes dangerous when it's combined. So, suppose you buy a smart fork. It tracks how fast you move your hand to your mouth to help you eat slower. The data is just motion timestamps, harmless. Then you buy a smart plate that tracks the weight of your food, also harmless. But if those devices share data, or if a third party acquires both data sets, suddenly they can infer exactly what you're eating, how fast you're eating it, and potentially detect tremors indicating a neurological condition.
But in a medical context, that inference is the diagnosis. That is the goal.
In a closed doctor-patient relationship, yes. But we're talking about the Internet of Things, where data flows between devices, clouds, and vendors. Fu et al. Argue that this mosaic effect, combining small pieces of data to create a full picture, means that privacy is effectively dead. And critically, they argue that privacy is tightly linked to security.
How so?
If a smart city collects data on my location to route traffic, which you say is essential for the ambulance, that database becomes a target. If a stalker or a criminal organization or a state actor breaches that system, my physical safety is compromised. They can track individuals in real time. The efficiency data becomes a targeting system. When we aggregate this much data, we are creating a treasure trove for adversaries. The loss of privacy in a smart city isn't just about embarrassment, it's about physical vulnerability.
I see the validity in the concern regarding data aggregation. However, we have to return to the central thesis of the Javaid et al. Research, the inevitability of this transition due to demographics. We have an aging population and a prevalence of chronic disease that our current analog systems physically cannot support. We don't have enough doctors or nurses to monitor everyone manually. We can't build enough roads to handle the traffic without smart management. The transition to smart cities and intelligent hospitals is not a luxury we are choosing, it's a necessity for survival.
Necessity does not imply safety. Just because we need a solution doesn't mean the current implementation is safe.
No, but it implies that the solution is to improve the technology, not abandon it. Javaid et al. Point to 5G and eventually 6G networks providing the low latency needed for safety-critical operations, and blockchain providing the immutable ledgers needed for trust. The ability to save a life through real-time monitoring, to have a cardiologist diagnose a stroke victim remotely in seconds, or to route an ambulance through a paralyzed city, that is the ultimate value proposition. We're building a nervous system for our civilization because the old body is failing.
That's a poetic way to put it. But I will remind you, a nervous system is capable of feeling pain, and it's capable of having a seizure. My final position, drawing from the warnings of the Computing Community Consortium, is that we can't treat safety, security, and privacy as afterthoughts. They must be solved simultaneously before widespread deployment. We need what Fu et al. Call cradle-to-grave requirements for devices.
What would that look like in practice?
It means we must prevent the zombie device issue by mandate. You can't sell a connected device unless you guarantee security updates for its entire physical lifespan. We can't have a hospital dependent on a sensor whose manufacturer went bankrupt 5 years ago.
That's a fair point on regulation.
It's more than regulation. It's about visibility. We need a dashboard for our device collections. Just as we have building codes that ensure physical structures don't collapse, we need rigorous safety standards for this digital infrastructure. Because, as we've discussed, the risk of a hacked hospital or a compromised smart home is physical. It's not just a glitch on a screen. It is a patient not getting their medication or a heating system failing in winter.
It seems we have reached the crux of the issue. The tension lies between the immense utility of these connected systems, the capacity to optimize resources and save lives at scale, and the inherent fragility that complexity introduces.
Precisely. The technology is seductive because of what it offers, the seamless city, the proactive hospital. But we have to ask if we are ready to manage the complexity of a smart ecosystem that includes everything from an MRI machine to a smart light bulb.
It is a question that city planners, hospital administrators, and, well, essentially every citizen will have to grapple with in the coming decade.
Indeed. And hopefully we can do so with our eyes open to both the benefits and the risks.
Thank you for listening to the debate. We hope this discussion has illuminated the different perspectives on the Internet of Things and its role in our future.
Until next time.